Gluteus medius is a little bit more lateral, out to the side as opposed to the posterior and the back. One of the easiest ways to access it doing mat work is to hook one foot under the knee. You're not in the popliteal space right under the knee, you're usually a little higher. You've got this little stop gap here. And then my other foot is going to slowly work its way behind the greater trochanter. I'm pressing into this space below the iliac crest, and again, lateral. I'm using the ball pad of my foot to push Andrea's hips and leg over. You'll see that I can get this sort of like sewing machine or rhythm going. This is a good way to get the muscle to soften initially. And then slowly I'm going to use the ball pad to sink right into the tissue. And I'm looking at her eyes to make sure it's not too much pressure. If I hold the pressure here, I can then jostle with this leg. I can move the ball pad of the foot a little more posterior. Press in again. See, there we go. Got a little response. This is not my lovely wife. This is not my beautiful house. And a little more jostle gets it to soften. Same as the temporal was. Same as the temporal was. So if I've used the ball pad, we soften that up. I'm going to use the heel. This is a much sharper implement. I want you to go slow. I'm leaning in above the greater trochanter. Not too much, just tender. Now, I've lengthened my leg. Sometimes I'll lift my kneecap. It feels stable. If I want more pressure, I simply just lean in, fairly deep to you, tender. Any referred pain at all? Okay. If people have referred pain in this area, it tends to refer around the hip, sometimes into the low back. This is a constant pain for a lot of people. I use this commonly on gluteals. Gluteus maximus, medius minimus, all fairly easy to address. If I decide to go more posterior, I can always just lift the person up. Again, if I push them over, reach a little lower, it gets my foot more posterior as opposed to lateral. But very easy way to work gluteals. And if I find another good spot, if I want to use the heel, you tell me if it's too much. There?
It's fine.
Fine. Now, if I pull here and pull here, it gives me some push on this leg. How's that? Deep? Good?
Oh!
Your wrist feels better. And after that deep pressure again, a little more jostle. Usually people are tighter on the right side, the right leg, right-handed, right dominant. It's also the gas pedal.